my name is Dr. Danielle Simon. I'm a physical therapist and the owner of Revitalize Performance, which is a performance-based physical therapy clinic that specializes in helping active individuals, athletes, and runners return to their sport or activity pain-free. Today, I'll be sharing with you the top 3 exercises that I give my clients that are dealing with lower back pain, hip pain, or groin pain, or pain in the front of the hip. Standing back bends are an exercise used in the prevention and relief of lower back pain, hip pain, whether that's in the back of your hips, side of your hips, or even in the front of your hips. So this is a standing exercise. I'm going to show you from the side. You're going to use your hands as a fulcrum and put them in the center of your lower back. Your knees are going to be in a relatively straight position. Slight bend will be fine. You just don't want a huge bend to the knees. And you're going to go backwards over your hands, holding for 2 to 3 seconds, and then coming back into a neutral position. With this exercise, you're going to perform 8 to 10 repetitions, and for relief of pain, you'll want to perform this exercise at a minimum of 2 to 3 times per day. So one more time, heading backwards over your hands, holding for 2 to 3 seconds, and then coming back into a neutral position. Figure 4 hip stretch is an exercise used in the prevention and treatment of lower back and hip pain, especially in the back of your hip. So what you want to do is lay down on the floor, or you can use your bed or a couch. And once you're all the way laying down, you're going to cross one leg over the other. Okay, so I'm going to show you what that looks like. So we're making that nice figure 4 position with our leg. You're going to rotate the leg towards the side of the leg that's up. You're going to hold for 2 to 3 seconds, feeling a nice stretch on the side of your hip, and then coming back up to a neutral position. Once you've done about 8 to 10 repetitions on one leg, then you'll go ahead and do the other side. For relief or maintenance of your hip muscles, you can perform this exercise about 2 to 3 times a day. Repeated hip extension is an exercise used in the prevention and treatment of hip pain, especially in through the front or in the side of the hip. So I'm going to show you 2 ways that you can do this exercise. The first is going to be in a half kneeling position. So you're going to want a pillow or a cushion underneath the knee for this one, okay? You're going to take your hand and you're going to put it on the top of your hip. And you're going to use this hand to help guide your hip forward. So you're using this hand to really push the hip forward, and then we're going to be feeling a stretch in through the front of the hip. Making sure that as I push forward, my midline stays in neutral. I'm not hyperextending or arching my lower back at all. This is really to focus on the hip and the hip only. Okay, so again, I'm pushing forward. And the other thing that you can do with this is actually tighten your glute muscle, so tighten your butt muscle, tighten this up, and then push forward, and you should get a nice stretch in through the front of your hip here. We're gonna hold for 2 to 3 seconds, and then we're gonna come back into a neutral. And for this exercise, you wanna perform this for 8 to 10 repetitions, and you'll do this about 2 to 3 times a day in order to get some relief of pain, okay? The other way that you can do this exercise, if we can't go into a half kneeling position, is in standing. It's the same exact setup. Hand is going to be on the top of your hip, and you're again pushing your hip forward. Really trying to keep that nice neutral mid-back or mid-spine here and not arching or leaning forward, okay? Again, holding for 2 to 3 seconds and then coming back out of